And the way that we do that is sort of interesting. So with the non-operative, we immobilize this for 4 to 6 weeks. Usually it can be a little bit shorter, it can be a little bit longer. The prognosis is really quite good for returning to sport. But if it is operative and we're able to catch it soon, typically we'll do a repair of this thumb UCL, as well as augment it with something called an internal brace or a very strong suture, which really helps with early rehabilitation. So we get the patients moving early, which helps to minimize the stiffness and as well as maximize the strength. If it's a chronic injury, if patients have had this before, or for some reason they come to us several months later, oftentimes we'll have to reconstruct the ligament with a tendon of theirs as opposed to just repairing it. And the outcomes after this aren't quite as good, but still reasonable. So with us, we really think about the stability aspect of it versus the mobility part of it. And typically return to play is in the neighborhood of 12 weeks, although it could be a little bit shorter or more typically a little bit longer depending on the player demands.